So if we look at the vaginal and bladder symptoms of HRT, as I explained in my previous video, a lot of women experience symptoms of vaginal dryness, pain during intercourse, bleeding during intercourse, and reduced sexual libido as well. And this can also affect your mood, leading to problems during a relationship. So in terms of treatment, you've got the option of lubricants, moisturizers, as well as vaginal estrogen. Now, lubricants are useful, which is something you can have during sexual intercourse. Moisturizers help to keep the vagina moist, and that's something that you can apply every day, regardless of having intercourse or not. However, a lot of these women find that this offers short-term relief and doesn't actually do the job of replenishing the vagina's tissue, which has now become thin and dry because lack of estrogen, and that's where vaginal estrogens come in. And what these vaginal estrogens do is they help to increase the blood flow back to the vagina, which means that the vaginal tissues are now hydrated, and it can come in different forms such as your tablets, gels, creams or sprays. And these vaginal estrogens are usually used alongside your oral or transdermal HRTs because oral or transdermal HRTs by themselves are not sufficient to help with the bladder or vaginal symptoms you have with HRT. I mean, there are a multitude of lubricants or moisturizers in the market. However, it's advisable that you should speak to your pharmacist or doctor before deciding which to go for, as some of these can contain chemicals like parabens or propylene glycol, for instance, which can cause irritation of the vaginal tissues. Also, with vaginal estrogens, there used to be a fear regarding the risk of womb cancer, for example. However, studies have shown that there is no evidence for long-term use of vaginal estrogens that can cause uterine cancer. So it is advised that you can use vaginal estrogens for as long as necessary. Now, in some women who have reduced sexual libido, it is also found that these women are lacking testosterone, the male hormone, and this is usually found on blood testing. Now, the male hormone testosterone is also produced by the ovaries. However, this is produced in small amounts, and the amount of estrogen usually suppresses the effects of testosterone. So testosterone can be used in the form of gel, spray, or implants. And again, they help with the symptoms of reduced sexual drive, fatigue, but it can have side effects of acne, deepening of your male voice, and hairy growth in unwanted areas. So this is something you have to carefully consider. So another option would be maybe trying a different type of HRT preparation before you consider going on testosterone. So in a nutshell, this is basically a quick summary of HRT treatments. I hope you found this useful, and you can feel free to check out my other videos on menopause treatments.